Hi, I'm Annie Green, and I'm going to be talking about how nuclear medicine procedures tie into Medicare coverage in the US. So, first, I just wanted to include some common nuclear medicine procedures, and I included bone scans, thyroid scans, PET scans, and gastric emptying studies. Each serve a vital role in diagnosing patients. Bone scans are also routinely done for certain types of cancer to help doctors know if the cancer has metastasized to the bones. Thyroid scans are another commonly used procedure. They aid in the diagnosis of nodules or cancer. PET scans are also key in detecting and monitoring cancer. And just like it sounds, gastric emptying studies determine the movement of food through the digestive system. Um, and despite the numerous procedures and the importance of them, not all patients have access to these scans due to financial obstacles tied to health insurance. And the cost of these procedures without health insurance can really deter patients from seeking out nuclear medicine procedures, which are, like I said, important for developing diagnoses for various health conditions. So, Medicare is what I'm going to be focusing on today. Health insurance is a very, very broad topic and not exactly the most exciting topic, but Medicare applies for people 65 years or older. That also can depend if you suffer from a disability or certain diseases, you could gain access to it earlier, but it's broken down simply into Part A and Part B. And Part A is automatically applied to adults 65 or older, and it includes inpatient stays. So let's say that you are at an inpatient facility and are in need of a nuclear medicine scan, that will be covered by Part A. Part B, however, is something that you must actively enroll in, and employer coverage or being included in a spouse's plan may take over a patient's coverage, but that again depends on person to person. The cost also depends. It's about $185 each month, but it could be higher depending on your income, and the amount can change each year. You'll pay the premium each month, even if you didn't get any Part B coverage, but you'll pay about $257 before original Medicare coverage begins. So, without insurance, here's kind of a general overview on the cost of scans. The national average cost for the procedure at inpatient facilities is $7,275, while the same procedure at an outpatient facility is average around $2,550. This can definitely vary from state to state and facility to facility, but the reason for the very large cost difference is because of interpreting the study of the procedure or just other general fees. But if a patient didn't have Medicare or any other uh, form of insurance, the full cost of the procedure will need to be paid out of pocket, which is very hard to do. It's a lot of money. So the reason I chose to focus on Medicare was because of the increased prevalence of chronic disease, functional decline, and cognitive decline of the aging population. So a very large part of the United States is in the aging population. The baby boomers are now entering that range of 65 years or older. And with aging comes complications. And so I included a statistic kind of outlining the percentage of aging population, and I also wanted to touch on the definition of medical necessity. And so Medicare relies on medical necessity to decide on which treatments are actually covered, and healthcare, it's defined as healthcare services or supplies that are needed to diagnose or treat illness, injury, condition, disease, or its symptoms that meet the accepted standards of medicine. And so It's up to Medicare to decide whether or not a patient is able to get coverage for a procedure. And so, obviously, as we saw in the last slide, it is so hard to afford these scans without insurance. If someone is already on Medicare, they're most likely not going to be able to afford an 8 grand scan. And so Medicare and coverage right now is controversial. That's why I chose this as my topic. There are policy decisions at the federal level that have restructured the healthcare system and has greatly affected individuals 65 or older. And like I mentioned before, our whole country is moving into that 65-year or older range. And so cost of low income seniors are expected to increase. And 1.3 million Medicare enrollees may lose access to aid in affording diagnostic scans. So this is, a lot of people may lose access to the nuclear medicine scans that I provided before. And obviously, without Medicare, it is super, super hard to afford these vital scans. And so I included a quote that kind of details what this means. $500 billion dollars in cuts between 2026 and 2024 Medicare is facing. And this creates a significant challenge that could affect the long term stability of Medicare and the care it provides to 65 million Americans. So, this access to affordable nuclear medicine scans is really up in the air, and we don't really know uh, what's going to happen in the future because of the policy change. And so, just going over the big idea, it's important that we as future healthcare professionals empathize with patient struggles to receive affordable healthcare. And with this aging population, they need help more than ever, and Medicare can only offer so much assistance, especially with the budget cuts it's facing. The financial burden of quality healthcare can significantly impact patients and can deter them from getting scans and making sure their health is okay. And this sheds light on the appreciation between patients and nuclear medicine technologists. As healthcare providers, it's super important to step into the patient's shoes and to understand how difficult it is to be the one getting the scan, be the one facing the bills, and be the one facing the diagnosis. And so I think that it's extremely important to just for a second take a pause and realize what our patients are going through on the paperwork insurance side of things. And these are my annotations that I included, and I hope you enjoyed this talk about insurance.